Welcome everyone. In this presentation, we are going to study some cases so that we can be able to interpret ABG report and diagnose acid-base disorder. Okay, so here is a case. A 45-year-old male suffering from bronchial asthma. Okay, note this, there is a bronchial asthma and was brought to emergency with a critical state with extreme difficulty in breathing. So he has extreme difficulty in breathing. So a blood gas analysis, that means ABG report, pH is 7.3. We will go to our basic pH. We take 7.35 to 7.45. Okay. For interpreting what I have said in earlier presentation, we should take 7.4. Okay. Anything less than 7.4 is acidosis. Anything more than 7.4 will become alkalosis. pH is 7.3. Definitely it is less than 7.4. So I will write here acidosis. My diagnosis will never change to alkalosis. Then I will see carbon dioxide, partial pressure of carbon dioxide. What is the normal? It is 35 to 45. Okay. But for interpretation, I will take 40. Definitely it is more. pH is less pH, more PCO2 goes for favor of respiratory. And he is also suffering from respiratory disorder, especially bronchial asthma. Now question is whether it is uncompensated, compensated. If it is compensatory, partially compensated or fully compensated. He also has, coming to next parameter is bicarbonate. What is bicarbonate here? What is the normal? 22 to 26. So average is 24. It is normal. So that means compensatory mechanism not as started. We can write it is clear-cut case of uncompensated respiratory acidosis. This is our diagnosis. So we'll see another case. We'll move on to the next case. So here is a 38-year-old man reported in the emergency ward of hospital with complaints of persistent vomiting, continuously vomiting since 1 week. This is very important point. He had generalized muscular cramp. He also had muscular cramp. On examination, he appeared dehydrated because of continuous prolonged vomiting. He appears to be dehydrated. Arterial blood was taken and they measured arterial blood gas. So ABG report is like this. So what is pH? Our normal pH is 7.4. If anything above, so I will write without seeing anything, only seeing pH, I will write here alkalosis. And remember, my diagnosis will not be converted to acidosis because first and foremost important step is see the pH. I will write alkalosis. Now I will decide whether it is metabolic alkalosis or respiratory alkalosis. I will see PCO2 here. PCO2 is increase. So PCO2 increase, if pH is less, it will go to respiratory acidosis. But I already written here alkalosis. See this PCO2 because it is increase. We know that it is increase. If pH is less, then it will respiratory acidosis. So we already written alkalosis. Alkalosis, we know that PCO2 will be less. So it is not a respiratory disorder. So I will go to metabolic component. You can see here increased bicarbonate. Okay, normally it is 22 to 26, average is 24. Okay, it is increased. When bicarbonate is increased, when there is alkalosis, definitely bicarbonate is metabolic component. I will add a word metabolic. Okay, I have made a diagnosis of metabolic alkalosis. Now remaining, I have to fill here whether it is uncompensated, partially compensated or fully compensated. Okay, let me draw our favorite buffer, bicarbonate carbonic acid. Okay, so in this particular scenario, we saw numerator is increased, metabolic alkalosis. We have to see for compensation denominator. For compensation, denominator has to be increased. What is the component of carbonic acid? It is nothing but PCO2. We will see now. We will go back to and see PCO2. What is PCO2 here? 50 millimeter of mercury. What is normal? 35 to 45. So definitely it is increased. That means compensation started. Okay, compensated. Definitely it is compensated. Now question is whether it is fully compensated or partially compensated. Again we go back to pH. pH is, what is the normal range of pH? 7.35 to 7.45. So here pH is not within the range. It is still very high, 7.8. Means it is not fully compensated. So I can write partially compensated. Previous example it is uncompensated because another parameter is normal. Here you can see already bicarbonate is increased and compensation also started because PCO2 is more. So our diagnosis will be partially compensated metabolic alkalosis. Okay, that is identify the nature of acid-base disorder. It is partially. What could be the cause of acid-base disorder? Because of prolonged vomiting. So prolonged vomiting, loss of upper GI fluid along with the hydrogen ion. Give reason for development of muscle cramp. We learned that in metabolic alkalosis there will be hypokalemia. So hypokalemia there will be muscle cramp. We'll see another example. You will understand better. See, read carefully. A 60-year-old woman was admitted with the lobar pneumonia. Again, respiratory problem. ABG report shows pH is 7.3. I will not see any other parameter. I will see pH. It is less than 7.4. So I will write it is an acidosis. Acidosis may be respiratory or metabolic. Next I will go for PCO2. PCO2 increase. So definitely acidosis, PCO2 is more. That means it is again respiratory acidosis. Now we have to write whether it is compensatory. If it is compensatory, partially compensatory, fully compensated or uncompensated. For that we need to see our bicarbonate. Bicarbonate normal level is 22 to 26. That means it is increase. Then I will write with the example of bicarbonate buffer. In this case the primary change is increase in the PCO2. Increase in the PCO2 means increase in the denominator, carbonic acid. So compensatory mechanism should be increase in the bicarbonate. There is already increase in the bicarbonate, that is compensated. Now question is whether it is partially compensated or fully compensated. Okay. For that we need to go back to pH. What is the normal range of pH? 7.35 to 7.45. If it is this pH, if it is within this range, then it is fully compensated. Here acidosis means it should be between 7.35 to 7.4. Then it will be fully compensated. Here still it is less than 7.35. So it is partially compensated respiratory acidosis. Okay. Identify the nature of acid-base disorder. It is partially compensated respiratory acidosis. What could be the cause of elevated PCO2? Again, it is elevated PCO2 because of lobar pneumonia. There is obstruction to the airway. Accumulation of the carbon dioxide. Cause is lobar pneumonia. What is the cause of elevated bicarbonate? It is a compensatory mechanism. Kidney tries to conserve bicarbonate. So cause for elevated PCO2 is lobar pneumonia. So the last case will be like this. Okay, a 44-year-old moderately dehydrated man was admitted with the 2-day history of severe diarrhea. 2-day history of severe diarrhea. Electrolyte results they have given: sodium is okay, potassium decrease, chloride again it is increase, bicarbonate is decrease. So they have given anion gap 12. What is normal anion gap? 8 to 16 millimole per liter. So that means it is a normal anion gap. First we will see pH. What is pH here? 7.31. So it is less than 7.4. So I will write acidosis. Okay, then I will go to next parameter, partial pressure of carbon dioxide. Normal partial pressure of carbon dioxide would be 35 to 45 millimeter of mercury. For interpretation we have to keep 40 in our mind. Okay, it is less PCO2. Okay, definitely it is not a respiratory acidosis, because we know that acidosis, if it has to be respiratory, there should be more PCO2. So respiratory acidosis is ruled out here. Then I'll go to another parameter, bicarbonate. Bicarbonate is decreased. Normal it is 22 to 26. Okay. So bicarbonate is metabolic component. So I will write the word metabolic. Metabolic. My diagnosis is metabolic acidosis. We have to see whether it is compensated or uncompensated. If it is compensated, partially or fully. Okay. For that, I need to write my buffer. Okay. So what is the primary change? Metabolic. Metabolic means bicarbonate. So bicarbonate is decreased. Numerator is decreasing. If numerator is decreasing, in order to bring back the ratio 20:1, denominator has to decrease. Denominator in this case is PCO2. So we will see PCO2. Yes, definitely PCO2 is decreased. So there is a compensation. But this compensation is fully or partially. For that again I go back and see pH. Still it is not within the normal range. So this also partially compensated. Compensation started but pH is not established fully normal range. Partially compensated metabolic acidosis. Partially compensated metabolic acidosis. So we learned in the anion gap metabolic acidosis can be normal anion gap metabolic acidosis or high anion gap metabolic acidosis. Here in this case they already given the value of anion gap is 12. So it will goes in favor of normal anion gap metabolic acidosis. Okay. Here we can write our diagnosis as partially compensated normal anion gap metabolic acidosis. Okay, that is our correct diagnosis. What could be the cause of acid base disorder? Definitely because of loss of lower GI fluid in the form of diarrhea, loss of bicarbonate. Okay, so in this way you need to learn how to interpret ABG report. It will be helpful for especially saving the patient. So this ABG always required a critically ill patient, especially in ICU. That's all about ABG interpretation. Thanks for watching.